Recognized member from Skeena.
Thank you, Honourable Chair. I'd like to move the discussion now to a topic that is of grave concern to folks who live in the Northwest, and it's a public health issue around the increase of SO2 emissions in the Kitimat and essentially the Kitimat Terrace airshed. I should, through you, Honourable Chair, just inform the Minister that I have already learnt lots about what the Minister of Environment, his colleague, has to say about this issue. I've also canvassed this in estimates with the Minister of Labour to discuss what this has in terms of WorkSafe BC. But at the end of the day, Honourable Speaker, I think the Minister would agree that this topic is first and foremost a public health issue. And while I know that the Minister's staff will probably be very well aware of the issue, just to provide context for these questions. So Rio Tinto's new smelter is hopefully going to come online in the next few months, and it's got brand new technology, and the good news is that out of the 5 toxic substances that have been monitored for the last 50 years, 4 of them are coming dramatically down. One, unfortunately, SO2 emissions is going dramatically up, 56%. The reason for that is twofold. There's going to be an increase in production of aluminum, and it's a requirement to have petroleum coke used in the process for making aluminum. So, as a result of this, the company applied for a permit to increase the SO2 from 27 million tonnes to 42 million tonnes, and this was given to them with conditions. But this, of course, is causing grave concern to folks who live up there as to what the outcomes will be in terms of public health. So my first question to the Minister is this. Has there been any effort from the public health officials from Northern Health to have input into the decisions around how to mitigate this increase in SO2 emissions?
Minister.
Thank you, Honourable Chair, and through to the member, the modernization at Rio Tinto Alcan certainly is a good news story in terms of the amount of money invested, obviously, and as the member noted, 4 components into the atmosphere are dramatically reduced, probably no more than, good example, than greenhouse gases. I believe it's a 40% reduction. It's significant. I remember, and I don't have the study in front of me, and I apologize for that, but when I read the study that was done, the modeling indicated that there were 2 areas where SO2 levels were in an area considered at risk if a person were to spend, a long period of time in those areas. And I believe those areas were in, non-residential areas. Having said that, there is work going on because we recognize that going from one level to a higher level of any chemical of potential concern is troublesome. And so the Ministry of Environment has committed to increased air monitoring. The medical health officer from Northern Health is part of those discussions, and there is a commitment, I understand, by Rio Tinto Alcan to participate in a human health study as this process moves forward. So we understand from the modeling done already where there are potential concerns, and with increased air monitoring, data will be able to be gathered to determine if in fact that modeling is real, and if there are chemicals of potential concern that are elevated above a level causing that cause a risk to human health, then Rio Tinto is committed to doing a health study. So I have sat down with the company myself personally. I sat down with the regional district, Stoney, I believe, Stoltenberg, and members of the regional district at UBCM and discussed this. I've sat down with executive team at Rio Tinto Alcan and discussed this. So I know that they are aware of the concerns. We have delivered the concern of the community to the company, and the Ministry of Health, Ministry of Environment are working together with the medical health officer to increase monitoring and have a plan in place should this modeling prove to result in any risk to human health.
Member.
Thank you, Honourable Chair. I'm glad that the Minister has spent time discussing this with the folks up there. Of course, the two main forms of mitigation that the company is offering, or the two choices that the company has, are to install scrubbers. And as the Minister probably knows, the new design for the smelter was designed to be able to engineer scrubbers in, but they weren't put in, but it is at least built, ready to have scrubbers put in at a later point. The other offer that the company is making, of course, and the modelling that the Minister talks about, is around dispersing this extra millions of tons of SO2 higher into the atmosphere than was current with the previous smelter. And the hope is that the airshed, the size of the airshed and the airflow, I'm no expert on this, but the airflow of this airshed will be such that it'll disperse this higher quantity of SO2 over a further reach, and therefore it will not be as toxic as if it was just sent out the way it is now. But my question to the Minister is this: if the monitoring proves that it is dangerous, what's the government going to do about it? What's the plan for the ministry? Is it to, because no one wants to see this brand new smelter shut down. So my question through you, Honourable Chair, to the Minister is this: if the monitoring proves that the SO2 emissions are not within the guidelines accepted by Health Canada, is the government then going to basically do their regulatory job and tell Rio Tinto that some form of scrubbers have to be installed? Is that the plan?
Minister.
Thank you, Honourable Chair. Let's go through a scenario. I think that would be helpful, I think, for me to kind of go through. The modeling says we expect it to be this amount in these particular areas. Once the increased air monitoring system is in place, the Rio Tinto Alcan smelter starts production, and the monitoring shows that, oh, in fact, the modeling was not quite right, as modeling is an estimate, and they're below, everything's fine. That would be the best case scenario, and increased monitoring would provide that reassurance if that was the case. If the air monitors show that the modeling was too conservative, and in fact the levels of SO2 are above that limit, that would trigger a number of actions on the part of both MOE and the medical health officer to get the SO2 levels down. And so they would work with the company to mitigate. And I understand there are different ways to mitigate. The member mentioned scrubbers. The alternative would be to use a different type of fuel in the plant. So there would be action taken, and yes, so there would be a different fuel source. So the environmental effects management plan that has been approved by Ministry of Environment lays all of this out, and the mitigation that is required if in fact the SO2 limits were exceeded.
Member.
Thank you, Honourable Chair. I think the challenge with using or trying to find a cleaner type of petroleum coke is that my understanding is that the sources of low sodium petroleum coke have been used up in the world. There's a shortage of petroleum coke, and the kind of petroleum coke that's used today is now significantly higher in sulfur than it was 10 or 15 years ago. So that's the challenge there, of trying to find a different source of that. So that may not work at all. But I'm happy to hear the Minister say that the Public Health Officer is very active on this file in the Northwest, because of course the retired Public Health Officer, Dr. David Bowering, who he would not know but some of his staff would know, is somebody with a very great reputation, who has come out saying that he's very concerned about these increases in SO2 emissions and what it would have on the health, particularly of seniors and children and anyone who has any kind of problem with regards to their lungs. So that is something that we really have to be careful of. But I have another question, and that is this. I have it on the record that the federal government is looking at reducing the acceptable levels of SO2 by law right across the country. And in fact, RTA, or one of the companies that's at the table in Ottawa, working with the federal government in terms of what these reductions would mean for them. If this was to become law, it would significantly affect the cement industry in British Columbia, RTA's smelter, as well as the smelter in Trail. So my question through you, Honourable Chair, to the Minister is this. If the companies are at the table working on this issue, is it also fair to assume that public health officers from the British Columbia government and other provinces are also at the table, giving the public health point of view to the government as they look at making recommendations to lower SO2 emissions in Canada?
Minister.
Thank you, Honourable Chair. I believe the member is referring to the Canadian Ambient Air Quality Standards that are scheduled for introduction next year, and my officials tell me that they will be consulted on those standards before they're implemented.